first question. His second question is, what has the feeling been like when it comes to MMR vaccines in small states in the Caribbean region? What have the numbers been like? And are you concerned that disinformation is playing a major role in the slowdown of vaccines in the wider Caribbean? Dr. Giselli, please.
Thank you very much for this question. So the latest data that we have on St. Kitts and Nevis and all countries and territories in the Americas come from 2021. So based on these data, the vaccines that we are monitoring for the routine immunization program show a coverage of about 99%, specifically for St. Kitts, and relatively high for other countries in territories in the Caribbean as well. And the same goes for the vaccine doses against measles, rubella, and mumps. However, if we look at the Caribbean as a whole, we find that more than 11,000 children younger than 1 year who live in the Caribbean, almost 1 in 10, did not receive all of their vaccine doses. So there's definitely have been an impact of the pandemic on coverage rates in the Caribbean, leaving many children vulnerable. So this is due in part to services not always being available, but also to a large degree to vaccine hesitancy, which is linked to misinformation. And all of this situation leaves the Caribbean susceptible to new outbreaks. And as the director was mentioning, with such a strong tourism economy as in the Caribbean, the risk of importation is high, which is why it is so important to strengthen vaccination coverage rates in all countries of the territories of the Caribbean, not just St. Kitts and Nevis, to stem the possibility of these new outbreaks. And PAHO is collaborating with ministries of health and partners across the region of the Caribbean to improve not only coverage rates, but also to provide and disseminate additional information regarding vaccines and vaccination to the general public and to healthcare workers.
Thank you very much, Dr. Giselli. Pasamos a una pregunta de Guatemala, Daniel Collin.
Now a question from Guatemala, Daniel Collin from TN23 Guatemala. He asks, due to the decline in vaccines or vaccination due to the pandemic, what is the panorama for Guatemala, and what are the diseases with the greatest fear or that we're mostly afraid that will return to that nation and that we believed were eliminated or controlled? Yes, thank you for your question. Guatemala has been working to increase its coverage rates. Guatemala has been seeing a decrease as other countries in the region in the number of vaccinations in the country. And we consider that as well as other countries, polio, measles, diphtheria could come back. So there's that danger. So it's important to strengthen the vaccination program and do stratified studies, prioritizing those areas in the country where it's necessary to work more quickly and more intensively. Guatemala has been working, and there has been support from PAHO in different areas, especially in ways to follow vaccination and also assisting the mobile vaccination brigades. And we have also been working hand in hand with religious leaders to strengthen the importance of vaccination so that children and adults do not miss doses, and so that they can have full coverage with the full schedule. We have a question from Violeta Vilar from Panama, Web de la Salud. We would like to know PAHO's position regarding the decision from FDA to recommend just the bivalent vaccine. Likewise, given whose recommendation to consider children as a low vaccination priority for COVID, what is PAHO's position on this? Thank you, Ms. Violeta, for this question. Regulating authorities like FDA authorize the use of vaccines. They do trials based on safety and effectiveness data. In the United States, in particular, we have the CDC, Centers for Disease Control. They do trials, and they continue to use monovalent vaccines, and they are recommending that for boosters, they start using bivalent vaccines. Each country should make their recommendations, weighing benefits of the recommendations, because if you use certain vaccines, you always have to take a look what the availability and access of that country is to those vaccines. All the evidence we have say that monovalent vaccines have high capacity to protect against all the severe forms of the viral disease and reduce death. So the recommendation by WHO and PAHO is that if we're going to use the existing monovalent vaccines, countries who have the bivalent can use them. But the great challenge in Latin America is not to change the recommendation from one vaccine to the other, but the great vacuum is the millions of people, adults with many comorbidities, people with immunization problems who have not taken or have not received their full schedule of COVID vaccines. We have millions of people in that situation, and that is our greatest challenge. The recommendation of WHO is that given the risks of each different group and subgroup to have serious disease. So if you compare younger children, their risk of severe disease is much lower than the risk for young adults and older adults. So the recommendation by WHO to clarify is children between 6 months and 17 years without comorbidities need to receive the primary schedule of vaccination for COVID-19, but there is no evidence right now that strongly suggests they need a booster. Children between 6 months and 17 years of age, if they have some immune compromise or other comorbidity, they should receive their booster. This is the recommendation. Each country will review this and will adapt it to their national realities. Thank you. Thank you, Director, for your answer. Now, Gabriela Solórzano from Puertos Confiables, Nicaragua. How do you evaluate the COVID situation in the country? Do you have more vaccines for Nicaragua, Dr. Giseli? Thank you very much for your question right now. And according to the data we received by April 6th, they have 90.1% vaccination coverage. They have already fulfilled the WHO recommendation, which recommended at least 70% of the general population. And congratulations also, because in 2022, their coverage rate increased from 45% all the way to what it is now. At this point in time, regarding the doses that are being sent to the country through the revolving fund, 1.5 million doses from Pfizer will be donated by Spain and will go to Nicaragua. Logistical details have been already discussed, and the vaccines will be coming soon. Thank you. Now, a question from Ana Lucia from Guatemala. Ana Lucia, hola. This is about the fact that Guatemala is one of the countries with the lowest coverage of vaccination against polio. How vulnerable is the country to have a case among children, as it happened already in Peru, given the large population in rural areas with high poverty levels? What support is being given to the country to increase their coverage levels? Dr. Salas, thank you for your question. In fact, Guatemala, according to what the advisory committee has been determined, is one of the countries with the high risk of having a reintroduction of polio or having an outbreak. So that's why it's so important to put children up to date with their vaccines, but specifically looking for those who have not been vaccinated. Vaccination campaigns must be able to detect and capture children who have not received prior vaccines. And of course, as we were saying before, it is very important that the basic vaccination schedule reach those children who need it. And Bajo has been working on mitigation programs, and also in Honduras, vaccinating against measles and polio. We will have had municipal and community leaders coming together. It's clear that if we want to take Guatemala and the whole of the region out of this immunization rut and gap, we need to mobilize all social actors and stakeholders, religious leaders, community leaders, as well as mayors and other authorities have to come together and help to be able to overcome this vaccination gap in the area. There's another question from Agencia Libre about vaccination against COVID-19 among children in Guatemala. Ana Lucia asks that, or says that there is a plateau, and not everyone has received their booster shot. So what does Bajo think? Should the country continue to try and vaccinate the rest of children against COVID-19? Dr. Giselli. Thank you, and thank you for the opportunity to answer this very important question. In March of this year, the SAGE, which is the Technical Advisory Committee, has published new recommendations for COVID-19 vaccine, including for children. In this new set of recommendations, which comes from reviewing studies from all over the world, WHO and SAGE recommend that children and adolescents, children between 6 months and 17 years of age, if they have comorbidities, they should receive not only the 2 initial doses, but a booster within 12 months after having received the last vaccine in the basic schedule. Children under 18 who are healthy are recommended to receive just their basic schedule, 2 doses. Each country will adapt these recommendations and tailor it to their epidemiologic situations and their socioeconomic status. But these are the SAGE recommendations. We should underline that from the beginning of the pandemic, the COVID rate in children has been low. Most cases of deaths in children and adolescents have been always in children with comorbidities. So if you give the basic schedule plus a booster, then we are focusing on vaccinating those who need the most protection. And this is not only for comorbidities. This recommendation is extended to those who have high risk of infection, severe disease, and death. For example, senior adults, pregnant women, or pregnant persons, people with comorbidities, and of course, healthcare workers who continue to be exposed to infection. Thank you. Thank you, Dr. Giselli. And now we can do a follow-up from Mexico.
The question is here as to the state of the world's children by UNICEF Mexico shows high trust that the vaccines are important to children, but they also show that Brazil is one of the countries that has a high number of children with 0 doses. Dr. Barbosa, I thank you for the question, Manuel. And once again, this is not a problem only in Mexico. Mexico and Brazil have a large population of children that have not been vaccinated, and those are the children that are the most concerning with the highest numbers in the region, but all of the countries need to review where they are and why those children are not vaccinated. I think it is very important to analyze each country, each state, each city. Oftentimes the barriers are different. For example, if the vaccination centers are not operating during weekends, or if there is only one person that works at the home and among the poorest of Latin America, that person would need to go 10, 12 times to that vaccination center to vaccinate her child. But if the vaccination center is not open during the weekends or in the evenings, that is a barrier for that person to vaccinate her child. If we do not have communication campaigns to provide the information that an important number of families require those vaccines, we're also leaving those individuals with their own doubts to vaccinate or not. Now, if we are not participating, and if we are not including the medical practitioners from all of the areas of specialty, nurses, technicians, doctors, so that they have the ability to answer a question by a family, do I need to vaccinate? Is that a safe vaccine? That information needs to be available. That information has to be shared with the individuals. So from PAHO, and also based on an important resolution approved by our member countries, we are at the ready to support those countries to update their immunization programs. And as I mentioned before, we are going to be leading in the Americas this initiative, which is a world initiative, which is the big catch-up for a whole year to work with Mexico, Brazil, all of the countries to identify the communities, the families, the neighborhoods that do have unvaccinated children, to identify the barriers and the strategies so that at the end of that year, we can say, okay, we do not want to have any more zero vaccine child. We want to have every child with the vaccine. Now we move on to a question by a colleague from St. Martin in English.
Seeing an increase in the number of people in the Caribbean region refusing to get vaccinated, or even wanting such to be, or not wanting such to be administered to their offspring. Have you been able to identify why? And if yes, what is PAHO doing to remedy that problem? Dr. Giselli, please.
Thank you for this question. PAHO and a number of colleagues, including UNICEF, have administered a number of surveys and data collection tools in order to understand exactly, as the question poses, what is the concerns surrounding COVID-19 vaccination, not only in children, but among adults and health workers as well. Some of the results that I can summarize here is that there are considerable doubts that we have understood with regards to the safety of the vaccines. Many have said that they seem to have been developed too quickly in order to assure the safety of the vaccine. And some have concerns about the effectiveness of the vaccines, since people who have received the vaccine can still become infected, even though the infection is either asymptomatic or quite mild. And the number of deaths and hospitalization is significantly reduced once vaccination coverage rates are increasing. So what PAHO has been doing is working with the member states, the countries and territories in the Caribbean to strengthen their vaccination program and close immunity gaps, but also to conduct behavioral research to inform immunization studies, communication tools, not only for the general public, but also for health workers and for decision makers at all levels. And then finally, specifically in the Caribbean, we are working very closely with CARICOM and with professional associations to make sure that trainings on vaccines and vaccination are an integral part of the curriculum of medical schools, nursing schools, so that every health worker, not only vaccinators, have all the facts at their fingertips in order to be advocates for vaccination and vaccines towards their patients.
Thank you, Dr. Giselli. Tomamos ahora una pregunta de Matías Levy.
Now we have a question by Matías Levin in Spanish from Medscape in Argentina. Matías is asking whether can we have a balance of the impact of COVID-19 in terms of the acceptance and the trust people have in connection with the vaccines. Dr. Barbosa. I thank you, Matías, for that question. Matías, we do know what the impact of the pandemic was to prevent children to get vaccinated. As I mentioned before, there are millions of children who have not been vaccinated for many reasons. In many countries, the health practitioners had to be redirected to emergency systems, to hospitals, ERs, because the individuals did not feel safe to get vaccinated whenever they had a very high infection rate during the pandemic. So the pandemic effect on vaccination is quite significant. And what your question is very important. If all of the pieces of fake news and rumors in connection with COVID-19 vaccines were a feature not only in Latin America, but in the world, and the impact that that may have on routine vaccination for polio, measles, diphtheria, and others. So we do not have data at this point in time, but we do have a very strong concern because it is true. These rumors continue, fake news continues, and it is very important for the ministries of health to be able to develop packages of information on the vaccines and also safety and how the process is developed, certification and efficacy of a vaccine prior to its authorization for use in people, how those vaccines are monitored. So these would be vaccines that are already known, but that are already familiar to everyone, but that are still monitored by all of the health authorities. And it is very important to properly review this so that we can involve health professionals. The data we have from some countries tell us that health professionals are the most reliable source for individuals to make a decision to get vaccinated or vaccinate their children. So having specific strategies for medical practitioners is very important, and also to have tools to involve community leaders, civil society, religious leaders, that is also very important. I think that our goal is to once again have not only health professionals who are directly working with vaccines, but all of the society to consider, to participate, to be there in a very active fashion so that we can continue to protect children in the Americas. Thank you. I thank you, Director. A follow-up question by Tomer Urbex from El Salvador in Uruguay as to those children that are lagging behind in vaccination. The question is, what is the profile? What are the characteristics of those children that are the most delayed in their vaccination schedule? Do we have a comment? Yes, this is Dr. Giselli. We do not have detailed information as to the characteristics of those children that are unvaccinated or under-vaccinated. We know that in general, they come from rural areas that are marginalized, but we do not have detailed information as to the neighborhood, for example, and that is the type of information that we need. Then PAHO is implementing multiple projects in several countries of the Americas, and we're also learning from other regions and countries that have already implemented these estimates so that we can determine where they live. And second, where these children that are eligible for vaccination have not received all of the doses. So we are using the mathematical models and satellite models, as well as experiences from other countries in our region, to be able to identify, based on the neighborhood they live, where the unvaccinated children are and how we can retarget our own resources to catch up. Dr. Barbosa, would you like to add some information to this? Yes, just to add to what Margarita just said, and also to underscore what she just mentioned. It is very important for the countries to identify what the groups are, and also I will give an example. In Brazil, very recently, there was a survey amongst the population to identify the groups that had vaccine coverage along 5 groups in various social groups. The highest problem we see is among those individuals who live outside the big cities, the poorest groups, and that have very strong social and economic barriers to have access to medical services. But we also see a very strong reduction among the wealthiest, and this may be related to fake news, fake information that was communicated during the pandemic, or unfounded information by some professionals, some medical professionals, practitioners that are not the best. So they are saying, well, they do not need vaccines because the child has good water and sanitation and the child is properly fed. That is not true. That child should also be vaccinated. And if you think of a child that comes from a proper social or from a high social level and at the same time is properly fed, in that case, measles may be a little bit milder than in a child that is undernourished and that comes from a very poor sector of society. So we need to strengthen and also highlight the commitment of our society to vaccinate children, to vaccinate each and every one of them so that they can protect all of the members of the community. Thank you, Doctor. This is a very important message. We have a final question from Bahamas, Taylor Simonet.
I'm saying this right, from Eyewitness News in Nassau, Bahamas. Tyler asks, routine vaccination rates have fallen in the Bahamas. How should the government handle this problem? Second, is the COVID-19 vaccination rate in the Bahamas satisfactory to PAHO? And third, are overall vaccination rates satisfactory to PAHO? Dr. Giselli, please.
Yes, thank you very much for this question. Like in the rest of the Caribbean and in most countries in Latin America, yes, vaccination coverage rates have fallen in the Bahamas during the COVID-19 pandemic. And PAHO continues to work with the ministries of health, with partners to strengthen not only the routine immunization systems, but taking advantage of events like Vaccination Week in the Americas to fill these most urgent gaps in immunization coverage. With regards to COVID-19 vaccination rates, again, as of the 6th of April of this year, so a couple of weeks ago, the coverage rate reported by the Bahamas was 41.7%, which it does not yet meet the threshold that the WHO had proposed of 70% as a minimum threshold for the population to be somewhat protected against COVID-19 transmission. So the Bahamas still has some work to do, like many other countries in the Caribbean, but again, with the focus on the populations at highest priority for vaccination. So once again, the older adults, pregnant women, persons with comorbidity, persons who are immunocompromised, and health workers, of course. And with regards to the overall vaccination rates, Bahamas does report coverage rates that are close to the threshold of 95% that we would like to see for most of the vaccines. However, we also noticed that there has been a dropout rate of 14%, which means that children who are going to the clinic to receive their vaccine shots at 2 months, 14% of them are not returning to the clinic to receive their shots at 6 months. And this, of course, is a concern. And it means that ministries of health, along with PAHO and partners, need to make sure that children and their parents are returning to the clinics to get their full series of vaccines so that they are fully protected against all of these diseases.
Gracias, doctora Giseli. Tenemos una pregunta interesante.
I thank you, Dr. Giseli.
En la región.
After several cases of dengue in the region, Mark Barone from Brazil is asking.
And Latin America. Director.
No, thank you. Thank you for this question. Of course, that dengue fever is a very important disease in the region. In Brazil, in many countries in Latin America, we are now exactly now at this moment have important outbreaks of dengue fever in some countries of Latin America and the Caribbean. But let's explain how is the process to have a vaccine introduced in the national immunization program. First, the vaccine needs to be approved by the regulatory authorities. So this new vaccine, there is a vaccine that is produced by a Japanese producer, Takeda. This vaccine was recently developed and presented the very interesting data during the clinical trials. It prevented around 61% of dengue fever cases and more than 85% of severe cases. So the data are really very impressive. Each country has their own regulatory authority. In Brazil is Anvisa. Anvisa has very recently assessed all the data provided by the producer Takeda and authorized the use of the vaccine. Also in the European region, the regulatory authority for Europe approved it, and also in Indonesia. That we know these are the three regulatory authorities that have approved this vaccine. Here in the United States, the FDA is still in the process to review the data. After being authorized, the vaccine needs to be recommended. So we need the countries, WHO, PAHO, need to review the data to see what are the groups that will receive this vaccine, and what is the strategy to get all these groups. So we are in the process to discuss what is the strategy. Probably the strategic advisory group of experts on immunization of WHO that makes the recommendation about vaccines for WHO and also for PAHO. We will probably discuss this later this year in the second semester. But at the same time, you have already started the negotiation with the producer of this vaccine, because when this vaccine is approved, the producer receives the pre-qualification from WHO. We want to obtain an affordable price to offer these vaccines to the countries in the region that you want to use them. And it will be very important if you have countries with important, very, very big population like Brazil, like Mexico, like Colombia, like Argentina, and others, if they come together to purchase these vaccines through PAHO's revolving fund, we can have a very important leverage in the negotiation, and this vaccine probably will have a more affordable price to our countries. Thank you.
Thank you, Director. Gracias, Director. Colegas, estamos llegando al final de nuestra sesión.
Colleagues, we're reaching the end of this session. We have addressed most of the questions. Some of these are quite specific, but we are going to share an information sheet and some links. But before we conclude, I have a follow-up question. Dr. Barbosa, you mentioned the regional platform for vaccines that we are working on here at PAHO. Could you please update the journalists? Yes, thank you. I think that this is a very important initiative. Our member states have approved 2 years ago a very important resolution to request PAHO to lead efforts to be able to reduce the vulnerability of Latin America and the Caribbean. Unfortunately, Latin America and the Caribbean imports 100 times more products than what they export. Our countries had difficulty in having access to personal protection equipment for health practitioners and also respirators and vaccines. So this platform started with a selection with 2 projects, one in Argentina by Synergy, a consortium, and another one in Brazil. with biomanguillos. And in the case of Brazil, this is the challenge to produce a vaccine that has the same technology as the mRNA, and this is the technology that has been used in Moderna and Pfizer vaccines, for example. This platform is very important because it will have the ability to produce vaccines based on the mRNA. This is a vaccine that will be used in the future for another coronavirus, and coronaviruses are always strong candidates to produce public emergencies, and the SARS crisis was a coronavirus. The MERS crisis in 2011, 2012 was another coronavirus. Now we had a third coronavirus, SARS-CoV-2. So these are always candidates to produce internationally recognized emergencies. So this technological platform will guarantee that we have within our region the ability to produce vaccines against coronavirus, or even for pandemic influenza virus, even for other important diseases such as chikungunya, dengue, Zika. So we do need to control and learn about this technology. PAHO is supporting studies that have to do with intellectual property, technical visits in connection with both products, so as to help for the hub to produce these vaccines. And we have several initiatives that would allow us to obtain this technology in our region. There are other initiatives, other efforts that are being implemented as part of the regional platforms, such as to support the quality certification of products that are manufactured in Central America, and products for personal use, for personal protection. So this is a mid-long-term initiative that will be reducing the vulnerability. Let me highlight that here we're talking about the production of messenger RNA vaccines in Brazil and Argentina, but the vaccines to be produced there will not only benefit Brazil and Argentina, but all of the countries of the Americas and the Caribbean by means of our revolving fund for vaccines. So in addition to strengthening the technology component, the ability to manufacture these products is key to strengthen Pan-Americanism and also the solidarity that we should have in our region. Thank you very much. Thank you, Director, for this update. Colleagues, we have reached the end of today's session. And briefly, we will be sharing with you an information sheet and also a communique about the situation in the region, and also specific links for you to find information. Clearly, we will be happy to address any follow-up question or request. You can send that to my colleagues, to myself, to Ashley, Sebastian, by using mediateam@paho.org, and also by means of our website. You will be able to find information about PAHO's campaign, where it says where we will see that each vaccine counts. We will be sharing information soon about the next press conference, and I thank you, Director, and I would also like to thank Dr. Giseli, Dr. Salas, our spokespersons, for their participation, and clearly for journalists for connecting today. Greetings and have a good week. Thank you.